There's a case that comes back to me often. A woman named Karen, her dog, Biscuit, a 10-year-old miniature schnauzer, the kind of dog that had been at her side through 2 moves, a divorce, a new job. She brought him in because he'd been drinking more water than usual, urinating more. She assumed it was heat, or maybe just age. When we ran his blood work, his glucose was 487. His pancreas had been quietly failing for at least a year. She asked me, "What did I do wrong?" And I had to tell her something that sits with me every time I think about that appointment. She didn't do anything wrong in the way she understood wrong. She fed him a well-known grain-free brand, premium price, vet-approved marketing language on every bag. She thought she was doing everything right. The answer to what actually happened to Biscuit was on the ingredient panel the entire time. Right there, the 4th and 5th ingredients. I'm going to tell you exactly what those ingredients are. I'm going to explain what they do to a dog's pancreas over years of daily exposure. And I'm going to show you 3 things, specific, measurable, affordable, that you can do differently, starting with your dog's next meal. If your dog is over 7 years old, I need you to stay with me for this entire video. Because the window where this disease is still preventable, not manageable, preventable, that window is open right now, but it closes. There's something that most people don't understand about how canine diabetes develops. They imagine it happens the way it happens in movies. Suddenly, dramatically, a dog collapses. A diagnosis arrives like a verdict. That is not how it works. Think about your car's engine. When you use the wrong grade of fuel, not something dramatically wrong, just slightly wrong, consistently, the engine doesn't seize overnight. It runs, it drives, it seems fine. But inside, the combustion chambers are accumulating deposits. The pistons are working harder than they should, week after week, mile after mile, and then one day the mechanic puts it on a lift and tells you the damage is severe. And you say, "But it seemed fine yesterday." That is almost exactly what happens in a dog's pancreas. The pancreas produces insulin. Insulin is the key that unlocks your dog's cells so glucose, the fuel from food, can get inside. That's the whole job. When a dog eats a meal that causes a large, rapid spike in blood glucose, the pancreas has to produce a surge of insulin to match it. It does this thousands of times across a dog's lifetime. The biological structures responsible for that, the beta cells, are remarkably resilient, but they are not indestructible. When beta cells are forced to produce excessive insulin day after day, year after year, they undergo a process that researchers now call chronic hyperinsulinemia. The cells don't just get tired, they get damaged, they stop responding normally. The glucose stays elevated, the body calls for more insulin, the remaining beta cells work harder. And then, at a certain point, usually around age 8, sometimes sooner in genetically vulnerable breeds, they fail. Not slowly, all at once. And when canine beta cells fail, they do not recover. Unlike in cats, who can sometimes achieve remission with dietary management, a dog that has lost its beta cells will need insulin injections for the rest of its life. That's the mechanism. That's what's happening inside the dog you can't yet see anything wrong with. And here's what stays with me after 22 years in internal medicine. The damage driving that process is usually dietary. And it usually traces back to 2 specific categories of ingredients that have become ubiquitous in commercial dog food over the last decade. I've treated somewhere in the range of 4,000 dogs with metabolic and endocrine conditions over the course of my career. I've seen this disease in beagles, in labs, in mixed breeds, but I've seen it most often in dogs whose owners were actively trying to do right by them, who switched to grain-free because they heard grains were inflammatory, who bought the bag with the words "natural" and "limited ingredient" printed across the front. And I keep asking myself the same question when I look at their records. How did it get this far? The answer, more often than not, begins with what was in the bowl. When Karen switched Biscuit to grain-free food 8 years before that appointment, she was making the decision that millions of dog owners have made. Grains cause inflammation, the marketing said. Your dog is a carnivore. Remove the grains. The problem, and this is critical, is what the manufacturers put in to replace the grains. Look at any grain-free kibble. The grain slot in the recipe has to be filled with something that provides structure and energy. In the vast majority of grain-free formulas, those ingredients are tapioca starch, dried potato, or potato flour. Here's what that means metabolically. The glycemic index of tapioca starch, the measure of how rapidly it converts to blood glucose, is substantially higher than most common grains, higher than oats, higher than barley, in some measures comparable to or exceeding table sugar. So the owners who were trying to protect their dogs from inflammation were feeding them an ingredient that creates one of the fastest, steepest glucose spikes a commercial dog food can generate. Every meal, every day, for years. Now, when you look at your dog's current food, and I'd like you to actually do this, flip the bag over and find the ingredient panel. You're looking for the first 5 ingredients. Those are listed by weight before processing and represent the bulk of what your dog is eating. If you see tapioca starch, dried potato, potato flour, or potato starch within those first 5, what you're looking at is the primary carbohydrate driver in that formula, and its glycemic effect on your dog's beta cells is significant. The alternative isn't complicated. Foods that use barley, sorghum, green lentils, or steel-cut oats as their primary carbohydrate source produce a meaningfully lower glucose response. You don't need a prescription diet. You need a different ingredient in position 4 on the label. Biscuits food. 4th ingredient, tapioca starch. 5th, dried potato. Karen had no reason to know that mattered, but it did. The second ingredient category I want to talk about is one that hides in plain sight in a different section of the label, not in the carbohydrate slot, but in the treats and add-ons. I see this most often in the semi-moist treats, the soft, chewy ones that bend and feel almost like jerky. Dogs love them. Owners reach for them as training rewards. What makes those treats soft and shelf-stable for 18 months is corn syrup or its close chemical relative, maltodextrin. Both are listed openly on the label. Neither requires any deception. They are permitted food additives, classified as energy sources, but what they actually do in a dog's body is deliver an almost immediate sugar hit, a direct glucose spike with no fiber, no protein, no metabolic buffer. In a 7-year-old dog with beta cells that have already taken years of daily stress from a high glycemic kibble, adding a corn syrup containing treat on top of that is compounding an already existing problem. The swap is simple. Blueberries, green beans, small cubes of plain cooked chicken. These are whole food treats with fiber, protein, and a glycemic load that the pancreas handles without strain. You do not have to spend more money. You have to reach for a different thing on the shelf. I had a patient, a 9-year-old beagle named Max, arrived with what his owner, a retired teacher named Thomas, described as just slowing down a little. His glucose on the first panel was 312. He'd been getting premium kibble twice a day and 6 soft training treats in the evening. Every evening, without fail, for 3 years. When Thomas and I went through the ingredient panel on those treats together in the exam room, he sat quietly for a moment and then said, "I thought I was rewarding him." He was. He just didn't know what the reward was costing. Max went on insulin and never came off it. But his story is part of why I want you to know this before you're sitting across from me in that exam room. I want to stop here for a moment before I get to the third change, which I've seen produce the most measurable results in dogs that are in that pre-diabetic window, and mention something briefly. I've put together a complete nutrition guide that goes significantly deeper than a single video allows. Every low GI ingredient to look for, exact dosing protocols by dog weight and age, a printable checklist to take to the pet store. The link is in the description. Now, the third change, and this one I want to be precise about because the dosage matters more than people realize. Omega-3 fatty acids, specifically EPA and DHA from fish oil, are routinely recommended for joint support and coat health. What is less commonly explained is their role in insulin sensitivity. Here's the mechanism. Chronic, low-grade systemic inflammation, the kind driven by years of high glycemic feeding, interferes with insulin receptor function. Imagine the locks on your dog's cells getting coated in a thin layer of something sticky. The insulin key is present, but it can't turn the lock cleanly. That's insulin resistance at the cellular level. EPA and DHA from fish oil are potent anti-inflammatory compounds that work at that cellular membrane level. They reduce the inflammatory coating. They restore receptor sensitivity. But here's where almost every dog owner gets this wrong. The doses on the back of most pet fish oil supplements are therapeutic for a dog the size of a hamster. A 30-pound dog needs approximately 600 to 800 milligrams of combined EPA and DHA per day to achieve measurable anti-inflammatory benefit. A 60-pound dog needs closer to 1,200 to 1,600 milligrams. Most supplements dosed as directed deliver a fraction of that. Additionally, and this matters, fish oil oxidizes. Once a bottle is opened, exposure to air causes the fatty acids to degrade. Oxidized omega-3 is not neutral. It is actively pro-inflammatory. The supplement you're giving to reduce inflammation may, if it's been sitting open on a shelf for 3 months, be doing the opposite. Wild-caught sardine oil, kept refrigerated after opening, used within 6 weeks of opening. That is the specific form I use in my clinical recommendations. If you open the bottle and it smells rancid rather than faintly oceanic, replace it. The smell tells you what the label can't. One of my patients, a 12-year-old Labrador named Cooper, had elevated fasting glucose for 2 consecutive panels. His owner, Marcus, added correctly dosed, refrigerated sardine oil to his meals and switched his kibble to a barley-based formula. 3 months later, Cooper's fasting glucose was back within normal range. He wasn't cured of anything. He hadn't developed diabetes yet. That's the point. Marcus sent me a photo a few weeks after the second panel. Cooper was sitting up in the kitchen doorway, watching Marcus cook, something he hadn't done in months. Just sitting there, alert, present, not sleeping through the afternoon. That's what the window looks like when it stays open. The thread connecting all 3 of these changes is the same. High glycemic carbohydrates stress the beta cells directly. Corn syrup and maltodextrin in treats spike glucose rapidly and repeatedly. Insufficient or degraded omega-3s leave systemic inflammation unchecked, which accelerates insulin resistance. All 3 pathways lead to the same destination, beta cell exhaustion. And once you understand that, the prevention becomes obvious. Lower the glycemic load at every meal. Remove the glucose spikes from the treat rotation. Give the immune system the tools to keep inflammation from blocking insulin signal. 3 doors, 1 room, 1 pancreas you're trying to protect. Karen called me 6 weeks after Biscuit's diagnosis. He was responding to the insulin protocol, but she was still getting used to the injections. Before she hung up, she said something I've heard variations of more times than I can count. Why didn't anyone tell me this before it happened? I hear that question a lot. I heard it from Thomas, Max's owner. I've heard it from people who fed the best food they could find, who bought the premium brands, who thought the label was honest about what it was doing to their dog's body. The information exists. It's in the research. It's in the endocrinology journals. But the distance between that research and a person standing in a pet store aisle, reading an ingredient panel without knowing what they're looking for, that distance is the problem I'm trying to close. 1 in 300 dogs in the general population currently has diabetes. After age 7, that risk increases substantially. In miniature schnauzers, Australian terriers, and Samoyeds, it climbs higher still. The dogs who avoid it are not genetically luckier in most cases. They are better informed. If you have a dog over 7, look at the ingredient panel this week. Look at the primary carbohydrate source. Look at the treat ingredients. And if you're using fish oil, check the dose on the label against your dog's weight, and then check when you open the bottle. Before making any of these changes, particularly the fish oil dosing or a significant diet transition, bring your vet into the conversation. Tell them you've been looking at glycemic load. Ask them to run a fasting glucose panel if they haven't recently. They know your dog's history. The better the questions you bring them, the better the conversation you'll have. Biscuit is still with Karen. He gets 2 insulin injections a day and has adapted better than she expected. But she still thinks about what might have been different. I think about it too. That question, why didn't anyone tell me? It's the reason I'm still here, still talking.